Is addiction nature or nurture? When we think about addiction, a common question arises. Is it more about our genes or our environment? This topic has sparked a lot of discussion over the years. Let's break it down together. First, let's talk about nature, which refers to genetics. Research shows that if someone has a family history of addiction, they are more likely to develop an addiction themselves. This is because certain genetic traits can influence how the brain reacts to substances. For instance, some people may have genetic variations that affect neurotransmitters, the chemicals in the brain that help regulate mood and behavior. This means that their brains might respond differently to drugs or alcohol, making them more susceptible to addiction. Now let's shift our focus to nurture, which is all about the environment. Environmental factors play a huge role in addiction as well. These factors can include family dynamics, social circles, stress levels, and early exposure to substances. For example, if a child grows up in a household where substance use is common, they might be more likely to experiment with drugs or alcohol themselves. Additionally, experiences of trauma or chronic stress can lead individuals to seek relief through substance use, further increasing the risk of addiction. But here's where it gets interesting. The relationship between genetics and environment is not a simple one. There is a field called epigenetics that studies how environmental factors can change how genes are expressed. This means that even if someone has a genetic predisposition to addiction, their environment can influence whether that predisposition shows up. Conversely, genetic factors can also affect how someone reacts to stressors in their environment. Understanding this interplay is important for treatment. For individuals with a family history of addiction, being aware of their genetic risks can help them make informed choices to avoid situations that might lead to substance use. At the same time, addressing environmental factors through counseling and support can be vital in preventing or overcoming addiction. In the context of substance abuse, recognizing both genetic and environmental influences allows for a more personalized approach to treatment. This could involve using medication to address genetic predispositions or focusing on therapy and lifestyle changes to improve environmental factors. So, is addiction nature or nurture? The answer is that it is a combination of both. By understanding how these factors work together, we can better identify and address substance abuse, leading to more effective prevention and treatment strategies.